Good afternoon. Thank you for joining us. I will start with the usual daily report on the COVID statistics. The total number of positive cases reported yesterday was 1,739. That represents 19.8% of people newly tested and 9.7% of the total number of tests carried out. The total number of cases in Scotland since the start of the pandemic therefore now stands at 50,903. Of yesterday's cases, 605 were in Greater Glasgow and Clyde, 520 in Lanarkshire, 250 in Lothian and 105 in Ayrshire and Arran. The remaining cases were spread across 9 other health board areas. Now, I would remind you that an element of today's cases will be catch-up on the past few days, given the backlog in testing that we've had over the weekend and that I have spoken about earlier in the week. I can also confirm that 873 people are currently in hospital, which is an increase of 49 from yesterday, and 73 people are in intensive care. That is 3 more than the figure yesterday, although, again, for those who follow these figures very closely, let me point out that yesterday's figure was revised in the course of the day from 69 to 70, so today's 73 is an increase of 3. I very much regret, though, to report that in the past 24 hours, 28 additional deaths have been registered of patients who first tested positive over the previous 28 days. That is the highest number of deaths we've reported in the daily figures since the 21st of May, and it takes the total number of deaths under this measurement to 2,653. National Records of Scotland has also just published its weekly update, which you will recall includes cases where COVID is a suspected or contributory cause of death. And today's update shows that by Sunday just past, the total number of registered deaths linked to COVID under that wider definition was 4,376. 75 of those deaths were registered last week. That is 50 more than in the week before. And that is the highest weekly total since early June. 58 of the 75 deaths took place in hospitals, 12 in care homes and 5 at home or in other non-institutional settings. Every single death, of course, represents the loss of somebody who was special and loved. And I want again today to send my deepest condolences to all of the families and networks of friends across the country who have been impacted in this most extreme and cruel way by the impact of this virus. I want, though, to just give a point of context, though, and it doesn't in any way take away from the very upsetting nature of the statistics I have just reported to you. But today's figures on hospital and ICU admissions and the figures I've just reported on deaths are obviously clearly concerning, and we take them very seriously as we consider our response and our next steps in the fight against the virus. However, as Jason will touch on briefly as well, these figures, it must be remembered, relate to people who could have been infected with the virus perhaps 2 to 3 weeks ago. So they should not be taken as an indication that the current restrictions that we are all living under are not having any impact. And I'll say a little bit more about the early indications of the impact they're having later on. My main update for today, though, concerns the temporary restrictions on hospitality, which we introduced 2 weeks ago and which legally took effect on Friday the 9th of October. As I said yesterday, we will publish, and I can tell you now that we will do this on Friday, a new strategic framework for managing the virus and indeed living with the virus through the winter and into the early part of next year. That strategic framework will include different levels of restrictions that can be applied either nationally or regionally, depending on the level of infection across the country or in different parts of the country. Subject to parliamentary approval of the broad framework, it is intended that the levels will be applied from the 2nd of November and reviewed regularly thereafter. The detail of what level will initially apply to each part of the country will be assessed in the coming days and set out in advance of 2nd November. And it's important for me to be clear at this stage that given the nature of what we're dealing with and given some of the numbers I've just reported, albeit with the caveats attached to them that I did. We can't rule out that this new approach will entail further extension of existing restrictions or perhaps even tougher restrictions for all or parts of the country if we think that is necessary to safeguard health and life. But that will depend on up-to-date assessments of the impact of the current restrictions, and it's also important to be very clear that all of our decisions will be balanced by an assessment of the wider harms that COVID and the measures we're taking to tackle it are having, and that includes the wider harms to health and well-being and to jobs and livelihoods. The timescale for introducing the new level system, though, leaves us with a short-term decision about the current temporary restrictions on hospitality. These are currently due to expire on Monday coming, the 26th of October. However, following a meeting of the Cabinet this morning, I can confirm that we have decided to extend these measures for a further week. This is first and foremost a public health decision. Although we have grounds for cautious optimism that the restrictions are having an effect, the clinical advice to Cabinet is that it would not be safe to lift them as early as Monday. But secondly, the extension allows us to transition more smoothly to the new level system that we hope will be introduced on the 2nd of November. So I can confirm that the current temporary restrictions will now apply until 6 a.m. on Monday the 2nd of November, and that of course includes the tighter restrictions that are currently in place across the Central Belt. Let me run through what those restrictions are, but before I do so, let me take the opportunity to remind everyone that the rule against visiting other people's houses also remains in place for now, because that is the best way of limiting transmission from one household to another. But let me run through the wider restrictions. Firstly, and with the exception of the 5 Central Belt Health Board areas that I'll come on to in a moment, the restrictions mean that pubs, bars, restaurants and cafes can only operate indoors from 6 a.m. to 6 p.m. These premises cannot serve alcohol indoors at any time, although they can serve alcohol outdoors up until 10 p.m. In addition, hotel restaurants can serve residents indoors beyond 6 p.m, but not with alcohol. We also introduced much tighter restrictions in the 5 health board regions where case numbers have been especially high. Those are Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley. In these areas, all licensed bars and restaurants must remain closed indoors and outdoors, although takeaways are permitted. And again, there's an exception for hotels serving food and non-alcoholic drinks to guests. And cafes, whether licensed or unlicensed, can stay open until 6 p.m. to prevent social isolation, but they must not serve alcohol. In addition, in these areas, snooker and pool halls, indoor bowling alleys, casinos and bingo halls will remain closed for an additional week. Contact sports for people aged 18 and over will also remain suspended, with an exception for professional sports. Indoor group exercise activities will not be allowed for people aged 18 and over for that further week, although gyms and pools can remain open for individual exercise. And outdoor live events are not permitted in those 5 regions. Finally, we continue to advise people very strongly who live in these Central Belt areas not to travel outside the health board area that they live in if they do not need to do so. Similarly, people in other parts of Scotland should not travel to these areas unless it is absolutely necessary. I know all of this is really unwelcome, and I know that these restrictions are harsh. They are harsh financially for many individuals and businesses, and they are harsh emotionally for all of us. And so I want to stress again, firstly, that none of these decisions are being taken lightly. This is all about trying to save lives and minimise the health damage that this virus we know is capable of doing. But I also want to stress that we do believe these restrictions will make a difference, and indeed we believe they may already be making a difference. Even allowing for today's figures, though it is, and I must insert this note of caution, it's too early to be absolutely certain about any of this, but even allowing for today's figures, we think that we may be starting to see a reduction in the rate at which new cases are increasing. So the early data underlines the importance of all of us sticking with the restrictions that are in place. Now, given that today's Cabinet decision requires many businesses to stay closed or continue to restrict their trading, I also want to confirm today that we will extend the support, the financial support available to them to cover the additional week. Full details of that support and how it applies to different sizes of business will be published online. but there will be extensions to both the business support grants that we offer and also the support that we are providing at this stage for the job furlough scheme. All businesses will receive proportionally the same level of support over the extension 7 days for each day of closure as they did in the first 16 days of restrictions. And for this limited period, as I say, we're also extending the Scottish Government furlough support scheme for an extra week as well. Now, later in the week, when we publish the new strategic framework, we will also set out our planned levels of support for business in the future in the event of further restrictions. It is important to be clear at this stage, and this is a point that I will speak more about in days to come, but I want to be clear about it now, that while the level of support we set out in the strategic framework will be the maximum level of support that the Scottish Government is able to provide within the resources available to us at this time, it is the minimum that we think is necessary. So in common with other devolved administrations and indeed many councils now across England, we will continue to pursue urgent discussions with the Treasury about the provision of adequate support and funding to support businesses and individuals through the kinds of restrictions that are likely to be necessary in the period ahead. Now, I spent, for good reason, a bit of time talking about the extension to the temporary restrictions, but I want to draw my remarks to a close by just giving my usual reminder of the general rules and guidelines that we are asking everybody to follow right now. Again, let me remind people living in Lothian, Lanarkshire, Forth Valley, Ayrshire and Arran and Greater Glasgow and Clyde not to travel outside their own health board area unless they really need to do so. Let me remind everybody, all of us across the country, that we should not visit other people's homes right now, except for very specific purposes, if you are providing childcare or looking after a vulnerable person. And when we do meet people from other households, outdoors or in indoor public places that are open, for example, cafes, we shouldn't be meeting in groups of more than 6, and those 6 people should not come from more than 2 households. Please don't share cars with other people outside your household if you can avoid it. Work from home if you can, and download the Protect Scotland app if you haven't already done so. And finally, remember to wear face coverings when you are out and about. Remember to avoid crowded places. Remember to clean your hands in hard surfaces. Remember to keep 2 metres distance from people in other households, and remember to self-isolate and get tested if you have any of the symptoms of COVID. Thank you all for the sacrifices you continue to make. It will make a difference. I know it is hard, but we must stick with it in order to continue that process of getting COVID under control. I'm going to hand over to Jason for a few words before we take questions as normal.
Thank you, First Minister. The world this week reached 40 million COVID infections and also passed 1.12 million deaths. 5,500 people died yesterday of this disease. Europe has now passed 5 million cases. The world has not seen a global pandemic on this scale since 1918. Spain has had 14,000 cases in the last 24 hours and 218 deaths. France has had 20,500 cases and 262 deaths. You heard a number of large numbers from the First Minister today. Nearly 1,800 positive cases, a 10% positivity rate, 73 people in intensive care tonight, families, friends, concerned for them. 873 people in hospital, up nearly 50 in a day. And most concerning and most depressing of all, 28 deaths. Each of these numbers, from the global number through the other European countries to our own numbers today, are stark warnings of what this virus can do and what it continues to do to the people of Scotland. But there are also grounds for cautious optimism. What we discussed yesterday, the non-pharmaceutical interventions, the NPIs, the distancing, the hand washing, the face coverings, they work. Reducing contact with other people, it works. 2 weeks ago today, the senior clinical advisors to the government published an evidence paper. And in that evidence paper, we said the doubling time for infections was 9 days up to the 30th of September. And that had got worse. It had come down from 11 days in the week previously. On the 7th of October, 2 weeks ago today, there were 1,054 positive cases. So if the doubling time were 9 days, that would mean by the 16th, 5 days ago, there would have been 2,100 cases. And there weren't. So that would suggest the restrictions that are in place that you are following, from the household restrictions a number of weeks ago to the hospitality restrictions now in place and the others across the Central Belt, they are working. But they are working slowly. And that's why we are reluctant to move away from them. To balance that, though, in the week before the evidence paper published, there were a total of 18 deaths reported. And today we've reported 28 in a single 24-hour period. So your behaviour today literally saves lives, but not today. It saves those lives 3 to 4 weeks from now. This is not like doing life support at the side of the road and saving a life in that half hour. It is unfortunately much further away. Your hand washing, your distancing, your reducing social interaction save yours and others' lives, but not for 3 to 4 weeks. That's why it's so hard and so important that you stick to these restrictions. Thank you.
Thanks, Jason. Move straight to questions. Lindsay Bewes from BBC Scotland.
Thanks, First Minister. You previously indicated that the restrictions, the temporary restrictions that we're in just now for hospitality, were to be lifted at the end of the 2-week reset period. I wonder what has changed. Has there been a delay to the strategic framework being ready to go? And just on another issue, there are reports today the Scottish Government is outsourcing some of its contact tracing. I wonder if you can provide some detail on that. Does that suggest the contact tracing system is struggling to cope? And are there any concerns about the use of private firms, given what we saw happening in England when private firms were involved in the system there?
Thanks, Lindsay. Let me take the second part of your question first, because I want to be really, really clear about this and leave no room for any misapprehension about this or any room for this issue to be reported inaccurately. Test and Protect in Scotland is an NHS service. We have not and we will not outsource any part of our contact tracing system, and no part of our contact tracing system is run by the private sector. And I want to make that very clear. Because I think certain things are becoming or in danger of becoming conflated. We have not and will not outsource our contact tracing system, and it is not run in any part by the private sector. What National Services Scotland has done is recruit a small number of staff on a short-term basis from private companies as we migrate from a system that in its early days was staffed by people within the NHS who could be called on, as we migrate from that to a permanent workforce. But this small number of staff recruited from the private sector work within the NHS system. They work under the direction of the NHS, they are trained in Test and Protect, and they work as part of that integrated NHS system. They are not working to a private company that has been given the responsibility of running contact tracing. And that's not semantics. That is a very, very different thing. There's one other thing we've done, which I think is a good thing. We were contacted, or the NHS was contacted at an earlier stage of the pandemic by a company, Barhead Travel, to see if we could make use of any of their staff in contact tracing who might otherwise be facing redundancy. So we have recruited a number of them to be part of the NHS system to help with contact tracing. So yes, when we are recruiting people into an NHS system, we will go to different sources to get the people that we need to do the jobs. But a key point here, and it is a critical difference with how these systems work in some other parts of the UK, contact tracing is done within the NHS. It's an NHS system, and it has not been and will not be outsourced to the private sector. So I hope that is clear and puts to bed any potential misunderstanding of the situation. On the first part of your question, I mean, what has changed is really what I have set out. Yes, we introduced restrictions that we intended to be in place for 16 days. If we do nothing, they will expire at the end of that period, which would be at 6 a.m. on Monday morning. Our clinical advice is that, as Jason has just set out, we think there is grounds for cautious optimism that these restrictions, coupled with the earlier restrictions on household gatherings, are having an effect in at least slowing the increase in cases. But the clear clinical advice, which comes through our clinical advisors from the National Incident Management Team, is that it would be premature to lift them on Monday, and would perhaps, if we lifted them too early, undo the progress that is being made. There is also the transition to the new system, and we are taking, and I'm not going to apologise for this because I think it's important, we are taking some time to consult with different interests about the general levels framework, and we are going to put that to Parliament for debate and vote next week. And that kind of consultation, which I think most people think is a good thing, does take a bit more time than if we just decide ourselves in government and announce what we are going to do. You know, for example, I spent almost 2.5 hours yesterday afternoon talking to the other party leaders about the approach we are taking, and I've offered to speak to them again at the end of this week once we publish the detail, in case they have any suggestions for amendment before Parliament debates and decides the general framework next week. So that is the secondary reason, to make sure we have a smooth transition from temporary restrictions into that new system that I hope, subject to parliamentary approval, takes effect from the beginning of the following week. None of this whole situation is not one any of us would choose to be in, but I think in all the circumstances we're facing, that makes some sense. Next is Louise Scott from STV.
Thank you, First Minister. You're saying obviously we've seen progress with the current restrictions that have been put in place. How much progress would you need to see before you could move the Central Belt to be more in line with the rest of Scotland when it comes to hospitality? I'd also like to just ask, we are still hearing of businesses in argument with the council over whether they are a cafe. They believe they are a cafe, they believe they run like a cafe, but the council saying they are a business. But we are seeing in some ways a lot of crowding areas because there are so few places, so few eating establishments where people can now meet, and that's one of the only places they can meet, obviously, in the kind of with 2 households. So is there an argument of, for these businesses, they would actually prevent crowding and queuing at these areas, which we are seeing because of, I say, the lack of places open?
I'm afraid the reality is you can always argue these things in both ways. So you have more places open, you've got more places for people to go, and therefore you might have fewer people in every individual place that is open. But let's not forget, we are trying to stop people interacting. And therefore, my message to people, we've kept cafes open to give people who might live alone, be working from home, have nobody else to talk to, somewhere to go to meet a friend. It's not an open invitation to people who might otherwise go out socialising normally, all to crowd into cafes. And I have to appeal to a bit of human common sense here. But the other way, I could flip it on its side and say, if that's a concern, we just don't open anywhere and close down all cafes that we've allowed to stay open, and then there would be nowhere for people to crowd, so you wouldn't have that problem. We're trying to strike really difficult balances here. First and foremost, this is about the volume of people interacting, and therefore the volume of places that people can come together to interact. This is a virus that thrives on human contact, and it dies if we deprive it human contact. And that's tough for the humans not to have contact with each other, but that's how you kill this virus. And therefore we have to minimise the places where people can come together. We've already made the really, really tough decision to ask people not to go into the houses of their families and friends. That is horrendously tough. I find that as tough as everybody else does. The other kind of setting where people are more likely to come together, often in environments where aerosol transmission can be particularly problematic, are in hospitality settings. So we've had to take action there. We've tried to give a bit of flexibility for the reasons I've spoken about, but that flexibility only works if all of us try to operate within the spirit of this and remember what the objective of it is. If all of us operate in a way of trying to get round these restrictions, then the inevitable conclusion, which I don't want to reach, is that they have to be stricter to avoid people getting round them. And we can live with more flexibility if we all don't abuse that flexibility and actually operate within the spirit of what we're trying to do. I'll hand over to Jason on the first part of your question. We look at a basket of measures, for example, cases per 100,000, the rolling 7-day average of cases, the lag indicators, obviously, of hospital ICU admissions and deaths, health service capacity. We have an overall ambition to drive the virus as low as possible. There are no hard and fast absolute triggers that lead to us moving from one level of restrictions to another. It's a basket of measures that we then also have to apply judgment to, taking advice of people like Jason.
You've covered it really well, First Minister. The decision making, if you think of it as a dashboard in an aeroplane, perhaps, where the dials are green, amber, or red, and you have a set of prevalence measures, you have a set of spread measures, you have a set of outbreak measures, and you might have a set of protect the NHS measures, because one of the challenges here is if intensive care becomes overwhelmed, then you simply won't be able to look after the number of people you'll have to look after. And you've seen that happening in the south of France in the last 2 or 3 weeks. At all costs, we have to avoid that. Your chances of dying from this disease increase if you're admitted, increase if you end up in intensive care. But if you can't get to intensive care, they increase dramatically. Your first question, just to emphasise something the First Minister said, the blunt public health advice here is not pleasant. The blunt public health advice is we're trying to reduce social interaction. We're not trying to give excuses for social interaction. I would love to go and meet my mum and dad in a cafe. I'm not going to do that. That's not an essential social interaction. They have each other, they can manage. If one of them was alone and not seeing anybody at all and very, very lonely, then that perhaps would be an essential social interaction in a cafe. And we would perhaps do that. But you have to think, do you need this social interaction? It is not about nightlife and having fun. I'm really sorry. For a while, it is essential social interaction only.
That is a really harsh thing to say, but sometimes it's important that we articulate it in those blunt terms, because these restrictions will only work if we all work within the spirit of them, and they are about reducing the ways and numbers of times that we are coming together right now. Jennifer Cordingley from ITV Border.
Thank you, First Minister. First Minister, can you give your reaction to the announcement today of 5 deaths at a care home in Dumfries and Galloway? And does this raise any concerns with you about how our elderly population are being protected?
We are taking, working with local authorities, directors of public health, who at an earlier stage in the pandemic were given overall responsibility for the oversight of the management of the virus within care homes, and working with care home providers to make sure that older people in care homes are as protected as possible. And that involves really tough things, and has involved tough things, very severe restrictions on visiting. We test now routinely every week staff who work in care homes. One of the things that we will include in the next iteration of our testing strategy is extending that to visitors who are regularly going into care homes. So we are taking a range of steps. But older people we know are particularly vulnerable to this virus, and that means it is so vital that we take those steps. But it also means that we have to constantly be reminding ourselves of the particular vulnerability that older people have, and that puts a responsibility on the rest of us to act in the ways we are talking about more generally to keep the virus under control in the community, to minimise the chances of it entering places like care homes where people are more vulnerable. But Jason may want to say a bit more about management in care homes.
Of course we're worried about care homes. The global care home outbreaks follow the prevalence in the community. That's true in every country. So when you get increased numbers in Lanarkshire and Dumfries and Glasgow, you are more likely to seed that virus into a care home. And you cannot simply put barbed wire around every care home in the country. We have tried really hard to protect the individuals and the staff in there as much as we can, but also we're under pressure, rightly, to open up in a person-centred way and allow people to visit. I've used this statistic from this podium before, and it is first wave, not present wave, because we've got better at treatment. But if you are over 80, you have a 1 in 6 chance of dying if you catch this virus. If you're under 19, you have a 1 in 10,000 chance of dying from this virus. So it is a stark risk if you're old. And that's why we have to protect those individuals as much as we possibly can. But it's also why, if it gets in, the risk is so high.
Thanks. Jack Foster from Global.
Good afternoon, First Minister. Obviously, I'm sure you're aware how devastating your decision for pubs and bars and restaurants across Scotland, especially in the Central Belt, will be today. Under even the most optimistic projections, huge chunks of hospitality are going to be forced to close. Thousands of jobs are likely to go, most at the lower end of the income scale. As we move towards the new tier system, how much clarity are you going to be able to offer the hospitality sector on support going forward, given that the current round of financial support is likely to dry up fairly fast? And indeed, many pubs and restaurant owners have told us that it will barely make an impact across the piece. Is there a longer term plan to support the hospitality industry, or are we just to accept that hospitality, the associated jobs, and indeed community are just a sacrifice in the fight against COVID?
No, and anybody who has listened to a word I've said throughout all of these 7 months, I don't think could fairly conclude that I lightly see anybody as a sacrifice in this. But equally, I don't stand here and try to give people false assurance over things that are out with my control, although I do my best and the government does its best to exercise as much control over them as possible. I partly answered your question in my opening remarks. When we set out the strategic framework, we will set out, not just for hospitality, but for business generally, the package of support that we will make available for businesses that under any future restrictions are required either to close or restrict their ability to trade. And the levels of support will be broadly similar to what's been already set out for England and other parts of the UK, and broadly similar to previous packages of support that we've put forward in lockdowns that have happened thus far. As I said in my opening remarks, what we will set out is the maximum the Scottish Government can do within our resources. We have a finite budget. We've had some consequential funding from the UK Government flowing from the decisions they've taken about business grants in these circumstances, and that's what will enable us, as well as making sure we maximise our own resources, to put forward this package of support. If you're asking me, do I think that is enough, then no, I sympathise with businesses that say they need much more support. But I have to be frank, within our current resources, we cannot do that, which is why, in common with other devolved administrations, in common with areas like Manchester, and obviously we saw this play out yesterday, we are making the case to the Treasury that there has to be much better funding flowing from them to devolved administrations, to councils in England. Obviously, money that comes to devolved administrations can go to councils in Scotland, but generally more money flowing to support businesses and individuals who will be affected by restrictions. I think we want to see that in a number of ways. Firstly, a return to a higher level of wage subsidy, the 80% at the start of the pandemic, as opposed to the 67% that will be part of the new furlough scheme that takes effect on the 1st of November. Secondly, a more generous approach to business support grants. But thirdly, and this may be connected to the second one, there is no clarity yet from the Scottish Government, for the Scottish Government, of how the kind of deals that we are seeing the UK Government strike with councils in England, or fail to strike in the case of Manchester, but Sheffield this morning or Liverpool last week, as we understand it, those are agreements for funding over and above the basic business support grants, but there is as yet no clarity about how any of the consequential funding from that flows to Scotland, so that our local authorities can also benefit from these kind of agreements. And these are issues that we are pursuing very vigorously with the Treasury, and we are not alone in that, as anybody taking even a cursory look at the media over the last few days can see. I understand acutely the devastation for people and for businesses of all of this. Standing here talking about this and even making the decisions, as I keep saying, they're the toughest decisions I've ever had to make, and hopefully the toughest decisions I will ever have to make. That's as nothing compared to the impact that the decisions are having on businesses and individuals across the country. And to say that weighs heavily on me every minute of every day would be an understatement. Doesn't help anybody pay the bills, I know that, but I want people to know that I don't take any of these decisions lightly. But I also know, in understanding and really empathising with the devastation, to use your word, on the part of businesses, I also know that there are 28 families across the country who had the devastation of registering a death of a loved one yesterday, that I've also had to report today. And none of that explanation makes this easier, but it is just a way of trying to, again, remind everybody of the horrible, invidious, no-win situation that a global pandemic puts us all in. And like leaders and governments across the country, what we are trying to do here in Scotland is strike the best possible balance. Is that a perfect balance? No, because I don't think there is such a thing in a global pandemic, but we will continue to strive to do that as best we can so that we are minimising the overall devastation of this virus as much as we possibly can. Alan Smith from Bauer.
Thank you, First Minister. Just picking up on what you were saying to Jack about what you'd like to see from the Treasury. If you don't get or don't see any of that action from the Treasury, could that ultimately hamper your efforts to control the virus in Scotland? For example, could it, put a limit on how long you could keep certain restrictions in place? And for those hospitality businesses who are seeing the restrictions extended until the 2nd of November when the tiered system comes into effect, realistically, should they be planning or preparing for longer term restrictions, i.e. it's unlikely that these current restrictions will suddenly be lifted on the 2nd of November?
Look, I'm not going to speculate on the 2nd of November. We will set this out logically and as clearly over the days leading up to that as possible. And what I can say is we will give businesses as much advance notice of any changes we're going to make as we can. On the first part of your question, I can't say anything. People know, whether you agree with me or disagree with me, I have genuinely tried not to be political in all of this, and I'm not being particularly political now either, but you cannot divorce these decisions from the financial ability to mitigate the impact of them. And if we don't get into a position where we are able to properly mitigate the impact, then I or Andy Burnham in Manchester, Mark Drakeford in Wales, Arlene Foster and Michelle O'Neill in Northern Ireland are going to be in the invidious position of either not taking the public health action that we really believe has to be taken to save lives, or taking that action, but knowing that we're not able to properly mitigate the financial impact of it, and then making the implications for jobs and businesses and livelihoods all the more severe. And that's just the reality of it. And you have heard Andy Burnham over the past couple of weeks, really set that out. And nobody wants to be in the position. Andy Burnham and I are of different political parties. I know him reasonably well. Ironically, we were both health secretaries at the time of swine flu, the previous pandemic. So I know from my insight into him that he will be agonising over the need to take public health measures in Manchester, but equally agonising over wanting to have the ability to properly mitigate that. And that's the position all of us are in. And the body with the ability, not to magic away all the difficulties, because it's not easy for them either, the body that can help with this is the UK government and the Treasury, because they hold the ability to borrow money, which all governments are doing right now. So that's why we must seek to work with them to try to make sure that the inevitable, necessary public health decisions we are all faced with making right now are able to be made, but also with that we can help to mitigate the financial impact. It's not going to be easy, but I really do think we need to see better and further support than is currently available. Katrine Bussey from PA.
Hello, First Minister. I wanted to ask about contact tracing today. You set the target some time ago of having 2,000 people working doing contact tracing, stressing that it's a really important part of containing the virus. I just wondered where we are against that target figure of 2,000. So how many people are working in contact tracing at the moment? And also the contract with the census, while you say it's not outsourcing and it's just recruiting a small number of people, how many people is it that are being recruited? And given this contract seems to date back to September, why is it we're only just hearing about this now?
Possibly because I don't think it is the big significant thing that people are trying to make it out to be. When we're trying to recruit people, we have to go out to different places and recruit them. That is a completely different thing to outsourcing. If we were asking Census or whatever private company to do our contact tracing, then the sort of questions that would be getting posed to me right now would be entirely legitimate. that's not what we're doing, and we will never do that. We are recruiting people into our NHS system so that we can do that. And you know, it is not semantics to draw that distinction. That is a very substantive distinction that I think most people can understand. I will have probably my 1 millionth and two go at explaining the 2000 and where that fits with our current capacity in contact tracing. The 2000 figure was, if you remember, the target we set for the contact tracers that we would have available by the end of May when this system started to be up and running. That target was met, but at the time we got to that target, and I've set this out many times before, by drawing on existing NHS staff, people who were taken from other roles, or in some cases people who were in the shielding category, so were not doing their normal jobs because they were having to be at home, so they could be used to do that. That was a temporary pool, and we met that target. Since then, we have been replacing that temporary workforce with a permanent, full-time, fully trained workforce. These figures are moving all the time, but I can tell you that as of now, there are over 1,800 fully trained contact tracers. That number by the end of this month will have increased by a minimum of another 245. So we have that region of contact tracers. It's important to say they will not all be working at the same time. Contact tracing is done on a 8 a.m. to 8 p.m. basis, 7 days a week. So there is a shift system. But to give you some context, over the most recent weekend, we had over 900 staff working on contact tracing. We would expect on current case numbers, our daily deployment per shift to be about 1,000 people working. So these are the numbers. But again, I keep explaining the sort of the context of the initial 2000 target and how we have migrated to where we are right now. I suspect it will not be the last time I explain it, but I'm perfectly happy to keep doing so. Christine Lavelle from The Sun.
Thank you, First Minister. It was just on today's reports that you're planning to introduce a 5-tier system for Scotland. There's already been some criticism today that from people saying that 5 tiers sounds unduly complicated and could confuse people. It was just to ask how you would respond to this. And also, just on care homes, you've said that the testing of asymptomatic visitors will be considered as part of the review of your testing strategy. Why wasn't this done before visiting rules for care homes were relaxed?
We take clinical advice. All of these decisions are clinically driven, and of course, because this is just the reality, have to be aligned with the capacity of our testing system. But we will set out more detail of where we are with capacity and also clinically driven testing objectives when we set out the strategic framework. On the issue about reports of, as I said, I had a session with party leaders yesterday. I've shared with them some of the details, so we are looking at a 5-tier system. Before I explain why, which I think is actually very logical, Ireland has a 5-tier system, New Zealand has a 5-tier system. I'm going to take a flyer here and bet that had I proposed a 4-tier system, somebody would have asked me if that was not maybe too complicated. If I'd gone for 3 tiers, somebody would have asked me if that was too few. If I'd gone for 6 or 7, then I would have got, whatever you sort of decide upon, somebody will say it's the wrong number. That's perfectly legitimate. I'm not complaining. I'm just setting out the reality. Let me explain the logic for the 5 tiers, which I think is very strong. The middle 3 tiers will be broadly, perhaps not absolutely, but broadly equivalent to the 3 tiers in England, which they describe as medium high and very high, or 1, 2, 3. So that will be those 3 middle tiers. We think we need one at the bottom, which is the level that we would be aspiring to this side of getting a vaccine, which is the kind of closest to normality that we can reasonably expect to live with until we have a vaccine or a more effective treatment for this virus. And we think it's important to have that so that we all know what we're kind of working towards if we stick with the restrictions in place at any time. The England system just starts at medium, which is quite a high level of restriction. But we also think we need another one at the top, because if you remember when England published theirs, a week, 2 weeks ago, I can't remember exactly now, the Chief Medical Officer in England at the time said that he thought the top level, the third level of theirs, was not enough to necessarily, in all circumstances, get the virus down. So we think we need one above that that is not identical to, but perhaps closer to a full lockdown if things got to be that serious. So that's the logic for the 5 tiers. As I say, it is not unheard of across other countries. Ireland went to tier 5 of their 5 tiers just earlier this week. And I think, as I say, New Zealand and I think other countries have got 5 tiers. But, you know, whatever you settle on, you will always get people saying it's the wrong number. Actually, what's more important is how you then apply those tiers in a sensible way that tries to keep the virus under control, with allowing people to live with as proportionate and targeted a set of interventions as is possible at any given time. Do I add anything about tiers, Jason?
No, I think that's good.
Okay. Sorry, I just thought you would want the opportunity to speak at some point soon. Scott McNabb from the Scotsman.
Thank you, First Minister. Given what you've talked about on business support, the lack of movement from the Treasury, does that heighten the likelihood that councils in Scotland may take a similarly confrontational approach to local lockdowns? And what can you say about liaison you're having with local councils in this process of the tiered approach? And also, if I may, perhaps with Professor Leitch, it was suggested today that the figures we've seen this morning shouldn't be taken as an indicator that current restrictions are not working. When will we see tangible results from that? And if we don't, is a Welsh or Irish style firebreaker inevitable?
I'll hand over to Jason on that last point. I would hope councils would join with the Scottish Government in making the case to the UK Government for additional funding, because we can't give councils money we don't have, and that is just a fact of life, much as I would want to give councils more money and businesses more money if we are implementing at any stage restrictions. We will work very hard to reach consensus with councils about what level of restriction should apply in their areas, and the strategic framework will set out, in summary, the decision-making process that we will go through in coming to those judgments. But I said yesterday, and I think some have maybe misconstrued this, maybe some deliberately misconstrued it, that the buck stops here with the Scottish Government and ultimately with me as First Minister. And I think some tried to construe that yesterday as some kind of control freakery or not trusting councils to make decisions. It's actually the opposite. If there's ever been a time in my government political career where it would actually be quite nice to offload the difficult decisions to somebody else, then this is it. These are horrendous decisions that I wouldn't wish on anybody. And I just take the view that it's not fair for me as the person elected with the responsibility to lead the country to expect those decisions to be taken by other people. Yes, I want to consult and I want to reach agreement where possible, but ultimately I just think it comes with the responsibility of being First Minister in the tough times, as well as in the less tough times, that you have to take the hard decisions and take responsibility and be accountable for those decisions. And that's what I meant by ultimately the buck stopping here. It doesn't mean we don't trust councils or won't work very hard to reach agreement with councils, but somebody has to take final responsibility for some of the most horrendous decisions governments anywhere are having to take. Jason.
It's difficult to be definitive, Scott, and if you listened at the beginning, and I wouldn't blame you if you didn't join right at the start, I tried to express the balance between are these working and are they working fast enough. This virus, unfortunately, doesn't help us much here. If it were norovirus with a few hours of incubation, then you would know tomorrow how many people had it and had caught it from you. This virus doesn't work like that. It takes weeks for us to know if lockdown is working, or if hospitality restrictions are working, or if household restrictions are working. So you can't tell on a Wednesday what you did yesterday is having any effect. So we have to use indicators that give us some indication. So the doubling time is one of them. There are lots of others, but the doubling time 2 weeks ago was 9 days. The number of positive cases hasn't doubled in 9 days. The doubling time is now clearly longer. That would suggest something is happening. That would suggest the non-pharmaceutical interventions are working, in inverted commas, but are they working fast enough? Because we've got 1,700 new cases today, 28 deaths, and 50 people being admitted to hospital. That's the balance. So, and every country is struggling with exactly that balance. How hard should you go? How quickly? Most of the public health evidence says act early and act harder, and then you'll get out the other end faster. But that's a real balance, along with the economic arguments that I've just played out in some of this questioning. I'm not immune to those economic arguments, because unemployment and businesses are public health interventions just like the restrictions.
Daniel Sanderson from The Telegraph.
Thanks very much, First Minister. When you originally announced the hospitality restrictions on October the 7th, you said there would be short and sharp actions designed to slow down the spread of the virus. Now, from what you and Professor Leitch have said, it sounds like they've succeeded in doing that. So haven't you misled hospitality businesses about the basis for these restrictions? It seems pretty clear you've moved the goalpost, given it was a 60-day closure and now extended by a week and then potentially indefinite after that. And also, just on the funding you spoke about at the start, given this was a 40 million package over 2 weeks, does this mean that it'll be another 20 million that will be provided to businesses, or will it be some other figure? Thank you.
It'll be proportional, so the amount of money for 16 days will be extended proportionally for an additional 7 days. So you can do, I'll leave you to do the arithmetic of that, but we'll set that out fully in the on the website later on. I'm going to pick up on your goalposts terminology, because if you know, I actually probably shouldn't, because this is not a game in any way, shape or form. But if you think about what we're trying to, what it is we're trying to prevent scoring goals, it's the virus. That's what we're trying to be the goalkeeper to keep out. And if we weren't prepared to shift the goalposts occasionally in the face of a virus that's pretty nasty, wily, changes and spreads in whatever way it can find to spread, then the virus would beat its hand down. It would be, you know, hammering in goals, you know, all the time against us. So having to change the goalpost sometimes and change course against an unpredictable infectious virus is part of what we're having to do right now. And it's a point I've tried to make and tried to explain all the way along. Usually with politicians, the last thing you ever want to do is admit you've changed your mind or changed course or got something wrong and had to rectify it. If any politician in a decision-making role takes that approach in the face of what we're dealing with right now, we're on a hiding to nothing. So I am not going to shy away from changing course where it is necessary to beat this virus, nor am I going to in any way underestimate the impact I know that has on businesses and individuals. So yes, we hoped that we could have these for 2 weeks. The advice is we think they're working, but we would potentially undo that benefit if we lifted them prematurely. And it would be, I think, wrong for me to ignore that, but equally wrong for me to extend them without also extending the financial support, which is what we are doing. And also being very clear that we are trying to transition from where we are right now to the strategic levels approach that doesn't magic away all of these restrictions, but hopefully gives people a greater sense of clarity, not a definite, absolute sense of clarity and certainty, because in this situation that is not possible, but a greater sense of clarity and certainty about the interventions we will deploy depending on different levels of the virus. So I know how difficult this is, but I don't do anybody any favours if I try to sugarcoat this or shy away from the hard realities of it. Derek Keeley from the Courier.
Thank you, First Minister. I wanted to ask you about the level of support available from November 2nd and specifically how that will be calculated. Can you say whether you expect to set levels, whether you expect set levels of funding or support packages to be tied to each of the 5 tiers, or would that be linked to population or some other kind of measure? Can you give us some further detail on how you expect that to be worked out?
Again, I find myself in one of these positions when I say I'm going to be publishing something on Friday, and then everybody wants me to say exactly what we're going to publish. We will set this out on Friday, but it will be so. Without going into all of the detail, it will be possible in more than one of the levels that businesses will have restrictions on them, therefore their trading will be restricted. So it will be a standard package of support measures that will not be tied to different tiers, but be tied to whether or not a business is being legally required to close under any of the tiers or legally required to restrict its trading under any of the tiers. So that's what it will be tied to, but we'll set out more detail of that on Friday. Alistair Grant from the Herald.
Hi there, thanks very much. We reported today that some restaurants and hospitality venues in Glasgow are flouting the current restrictions by staying open, with the council saying that final warnings have now been issued. What would you say to those hospitality venues ahead of the extension of the current restrictions? Do they risk contributing to a situation where the rules have to be extended yet again? And do you fear that more might try and bend the rules if restrictions continue? And if I can just ask as well, on the 5-tier system, and I know you said that this will be published on Friday, but could you say now whether school closures will be linked to the strictest tier, the tier that's akin to lockdown, or will they be considered separately on a case-by-case basis?
Again, I will resist getting into the detail of something that is going to be published on Friday, but I said yesterday, so that I will repeat it. Our default position is that we want to keep schools open regardless of what tier we are at. We recognise that the more the virus circulates and the higher up a level of intervention we go, the more on a case-by-case basis that may involve difficult decisions, and some kind of move to blended learning. It cannot ever be absolutely ruled out, but our absolute objective at whatever level of intervention applies in other ways is to keep schools open if we possibly can. And you know, as I said, yes, or pointed to yesterday, Ireland, when it went to its highest level of intervention earlier in this week, it said it was going to keep schools open. So that's what we want to do. I'll ask Jason to say a bit about this because he actually articulated it better than I did earlier on. But if what happens when we give a bit of flexibility for good reason is that everybody tries to maximise that flexibility and push the edges of it and find the loopholes to take advantage of it. Unfortunately, given the reasons we're having to put these restrictions in place, what that means is we'll have to give less flexibility in future. And I really do appeal to people, and this is not about not understanding how difficult it is, but if these restrictions are to work and therefore be in place for a shorter as opposed to a longer period of time, it involves everybody trying to work with the spirit of them. And the spirit of them is to reduce, as far as we can right now, unnecessary social interaction. And the articulation Jason used earlier on of his parents, because you know it's not essential to meet them in a cafe because they've got each other, whereas that might be a different consideration if one of them was on their own. That's the kind of judgments we're asking people to make right now. This is all about reducing the chances of the virus spreading from person to person. So we must all limit, as far as it is possible to do, the ways and circumstances in which we're coming together. But I'll hand over to the person who articulated it better than me to do so again.
I can almost feel my social media about to explode because I don't own a hospitality business, I don't own a cafe, I don't own a restaurant. So who am I to give advice about closure of their businesses? And I feel that every single day about the advice we give to the First Minister. But let's be clear, this is not individuals with diabetes and the diabetes only matters to them. This is a virus that if you get sick, it matters to me. It matters to everybody. There are public health and economic implications of not acting. The public health ones are clear. You're going to spread the virus. If you break the rules or you seek to reach the edge of the rules somehow rather than keep within them, you are putting you and other people at risk. But there are also economic implications of not acting, because it inevitably will lead to longer and longer restrictions. It will have to. If the virus doesn't suppress, we will need more restrictions. It's just a simple equation. So you have to follow the rules, whether you're a business owner or whether you're a single parent in a house trying to follow these same really difficult restrictions.
Devi Shridhar, who's often mentioned at these briefings because she talks a lot of sense and she's an advisor to the Scottish Government, I heard her say something the other day that is so true. It is not the restrictions actually that are harming the economy. It's the virus that is harming the economy. And the quicker and more effectively we can bring the virus under control again, then the quicker we can get the economy back to normal. So that means all of us prioritising getting the virus under control so that restrictions can be in place for a shorter as opposed to a longer period of time. And when you're a business owner not able to pay your staff and not able to pay your bills, I absolutely appreciate that is a really difficult thing to stand back and consider in that dispassionate way that I've just set it out there. But that is the reality of what we're dealing with. Rachel Watson from the Mail.
Thank you, First Minister. I just wondered if I could go back to the contact tracers and Katrine's question on how many contact tracers have been hired through these contracts with private firms. And also, you said earlier that this wasn't outsourcing. Can you tell us then, where will these people be working and whose equipment will they use? Will this equipment be issued by the NHS or is it issued by the companies that they actually work for?
These workers are working as part of the National Contact Tracing Centre. I'm not going to tell you exactly the location of their work, but they are working, and I don't know, I'll double check exactly who has the equipment, but they are working in an NHS-led delivered system, and that is that we're not asking another company to do contact tracing. In terms of the numbers for the NSS contracts, I mentioned separately at Barhead Travel, so put that to one side. I think it's less than 100 of the total contact tracers that we have. So it's a small number on a short-term basis. But you know, I know the temptation here to paint this as something else, but it's really not, and it really doesn't help our overall objective here for us to have this painted as something else. And in so doing, risk, even if it's just at the margins, diminishing anybody's confidence in our contact tracing operation. This is an NHS system. It is NHS Test and Protect. The app is NHS. I know there is some scepticism about the validity and legitimacy of that description elsewhere, but it is absolutely true here in Scotland. And the fact that we recruit into that system from other places does not change that. And I would appeal to people not to paint this as something it's not, because I want everybody with great justification to have confidence in Test and Protect, because it's doing a vital job and it's doing it well. Mark McLaughlin from The Times.
Good afternoon, First Minister. One for Professor Leitch. I wanted to ask about soft plays. Now, I know we're not in the business of relaxing restrictions at the moment, but given that nurseries are open and children can run about freely licking all the plastic surfaces in sight, why are nurseries open and soft plays closed? I'm thinking about this particularly coming into the winter months when the weather's bad and they can't go out and play in the swing park. And also, I understand there are some risks, but how do you balance that risk against the risks of childhood obesity over the winter and, you know, parents' mental health, which is fragile at the best of times when you've got a toddler?
Thanks, Mark. I think you asked that to Jason, so I'll let Jason.
There is a balance, Mark. Of course there is in all of these things, and we've tried to strike that balance by allowing more regulated activity to continue and more unregulated activity to close first, if that makes some sense. So nurseries, forgive me, are cleaning those licked items and not sharing as many toys as they might have previously, and are being careful. Now, clearly the kids are not distancing and there is some chaos in that environment, of course there is, but it is regulated. There is very strong guidance, good mitigations in place, and we have to trust that that's being followed. Soft play is another layer. It is slightly more casual, it's slightly less regulated, and it is also slightly more optional. It's not required for childcare for people to work, for example. But it is an important industry, and we've engaged just this week again with soft play. I think one of the ministers was engaging with the industry just this week past. There is guidance being developed. I think that guidance is due for publication quite soon. It won't indicate that soft play is going to open on a date, but it will allow soft play to work hard to get to the point where the mitigations are strong. And then we hope, as prevalence falls, as we move down the tiers, perhaps in some parts of Scotland, soft play would be one of the areas that would then be considered for opening. But it is not yet appropriate to open soft play areas. And I can also feel my social media from soft play about to go crazy because I don't own the soft play areas, and that's really hard for businesses.
And I know there'll be people who run or work in soft play areas right now watching this who think, and I'm not casting aspersions on this at all, that they can do what they do safely. I know that, and I know that they would be putting huge efforts into doing that. We're having to take balanced decisions on a whole range of things right now, but we understand the arguments that have been made about soft play, and as Jason says, want to engage with the industry, get guidance in place so that as quickly as we think it is possible to get these places up and running again for all sorts of reasons, the business reasons and the reasons that Mark has outlined. It's a few years since I used to take my niece and nephews to soft play, but I know how important these kinds of places are for parents, for kids to be able to play freely and run about, but also how important they are as businesses and a sector of our economy. So I'm really sorry you're in this position right now. Please don't think you've been forgotten about, and we will continue to work with you to get to a better position as quickly as we possibly can. The last question today is Richard Percival from the Daily Express.
Thank you, First Minister. I just wanted to ask about the new 5-tier system, if I may. And I know you've previously said you were considering introducing travel restrictions from other parts of the UK, so with higher COVID rates. If these were to be introduced, would they sort of form part of this 5-tier system, or would they be sort of like separate rules like Wales introduced, or part of the framework you've said? And also, could you just outline the discussions you had with Michael Gove last night? Thank you.
I didn't have any discussions with Michael Gove last night. I think there was a call scheduled with Michael Gove, but he had to postpone it, so that call is yet to take place. We will set out the 5 tiers on Friday. If I tell you everything that's in them right now, well, I'd be getting ahead of ourselves because we still have to finalise it all. But I'd leave you with nothing to ask me on Friday when we publish them, which I obviously wouldn't want to do. Travel restrictions will be part of this. If I can try to answer the question generally at the moment, when you move from a one-size-fits-all set of restrictions across the country, where it doesn't matter which part of the country you travel to, you're under the same restrictions, to a system where you might be under different restrictions in Glasgow compared to Inverness, then clearly in the latter approach, the need to consider travel restrictions becomes much greater, because otherwise the person in Inverness who's not living under these same restrictions could be at risk from the person from Glasgow who is coming to Inverness and perhaps seeding the virus there. So it's a bit like international quarantine. You have to think about these things when there's differing levels of restrictions. So that clearly will be a part of the overall approach that we set out. There is a secondary issue, which is one that the First Minister of Wales has already taken decisions around, and we want to see if we can reach we want to see if we can reach a 4 nations approach on the generality. But the secondary issue is, if you have travel restrictions, do you have them based on advice to people, as we do now for people in the Central Belt, or do you put it in law? Now, that's not an unimportant decision, but given the nature of what we're dealing with, the difference between advising travel restrictions and mandating travel restrictions is maybe not as great as some people think it is, given that you can't have a police officer checking everybody's vehicle. So even on a system that is underpinned in law, you have to rely on people abiding by that and not travelling where they're not meant to travel. So I think that the most important decision is when you ask people not to travel outside certain areas or to stay within a certain distance of their own home. And these are not easy decisions, but they are part and parcel at some times of the overall approach we take. And in general terms, in terms of the broad framework, how that fits with our 5-tier framework, I hope will become a bit clearer when we publish the document on Friday. Jason, do you want to say anything in conclusion?
I think our theme today is collective effort. We had headline numbers at the beginning of 28 deaths. Those people almost certainly caught this virus without trying about 3 to 4 weeks ago. So remember that what you do today saves lives a month from now.
I think that is a really important place to end. We do think all of the sacrifices that are being made right now are again having an impact. Too early to be definitive, and it's too early to say that it is absolutely taking cases in the downward direction, but we do see early signs of an impact. That's down to everybody sticking to these restrictions, and we will only continue it if people continue to stick to the restrictions. I know this is a really tough period again, as tough in many ways as it was in the spring of this year, but with the added burden of us all having 7 months of living with this, and we're all feeling fatigued and fed up, and just really, well, we just want to see the back of this virus, and trust me, all of us are in that position. But we have to stick with this, so please continue to do it. Please don't go into other people's houses, work from home, avoid car sharing, abide by the hospitality restrictions as long as they're in place, abide by the guidance on travelling, don't travel out of one of the central belt areas if you live in one of those to other parts of the country, and don't travel into those areas if you live in other parts of the country. And remember to cover your face, stay away from crowded places, clean your hands and surfaces, 2 metres distance, and self-isolate and book a test if you have symptoms. If we all continue to do all of these things, then I hope we will continue to see these signs, cautious signs for optimism that we see now, grow into much more concrete signs for optimism in the weeks to come. So thank you very much indeed, and I will see you again here tomorrow at 12:15. Thanks to Yvonne for our BSL interpretation today, and thanks as always to Jason for his help with the questions. Thank you.